The next segment is called the collective impact, and we will be talking about the power of collaborations. And one of the strongest collaborative teams right now focused on healthcare is right here in our room. We have representatives from the Zuckerman College of Public Health, El Rio, as well as the Canyon Ranch Institute, and I'm going to let you all introduce yourselves and then provide a 5-minute overview of your areas and how it is that you collaborate, and then we will open it up to questions from the class participants. Okay. Cindy, we'll start with you.
Okay, so my name is Cindy Thompson, and I'm short, so these chairs are really and I have been in Tucson for 30 years, and literally about 5 weeks ago moved my academic appointment in nutrition sciences over to the Mellon Eden Zuckerman College of Public Health, and I'm now directing the Canyon Ranch Center for Prevention and Health Promotion at the college, which is an existing entity that is being kind of refurbished, I guess would be the best word for it. So we're really up and going as a center. I actually started my career as a registered dietitian at Keno Hospital. And so for me, this transition in my career has brought me full circle in terms of the College of Public Health. So what I've tried to do for you is give you, in my 5 minutes, an overview of the Mellon Eden Zuckerman College of Public Health. As an academic, we always have to put something down as a handout, right? You have to have something tangible to take with you. And it's really, the perception is we're trying to help you, but really is to make sure that I cover everything I want to make sure you take home today. So, the college was founded initially through the hard work and effort of community members, people in academia, and legislators who said Arizona needs and wants a College of Public Health, and it took many, many years to happen. But I can tell you that it really is a star in Tucson and throughout Arizona. The college has grown tremendously in the last 12 years. We're up for accreditation again. No problem. I mean, we have had such an impact, and it's only because of our community partnerships. I really believe that. With the ability for the people in academia to get out into the community and for the community to access. We are accessible, so I want you to know that. The resources that are at the College of Public Health, and I've outlined just a few. We have a lot of diversity, not only at the College of Public Health, but across the U of A campus, as you know. We have students who have the most enthusiasm for what they're doing. They want to be out in the community. They want to make a difference. They want to contribute, and they value all of those things. So students are a huge resource that you can tap into. Academic freedom, I see that as an important aspect of academia. We can tackle some problems that maybe are a little more controversial and approach them with some innovative ideas. Certainly, grant funding is always part of what we do. I want you to know it's not all of what we do, but partnering with communities is the mantra, and that is where the government is going in terms of NIH funding. They realize the value of partnering the community with academia, so we're going to see more and more of that. And then just capacity building. I listed for you the 10 essential public health services. We don't need to go through them all, but I just wanted you to be aware of kind of what is the central national thoughts on what is public health and what does public health do for communities. And then I just wanted to talk to you a little bit, and I gave you a second handout about the issue of obesity, because one of the things that the Canyon Ranch Center for Prevention and Health Promotion really wants to address is obesity, and that's very consistent with issues that El Rio has dealt with what Canyon Ranch Institute has dealt with. And while I've had only limited time to build in this partnership, we definitely share common goals in terms of making the community well. And one of the issues that I think any of us in this room can understand is that obesity is one of the major health concerns of today that we have to start addressing in a more meaningful, more structured, more high-impact way, because it's going to affect all of us for years to come, whether we're lean or not. So that is my 5-minute spiel.
Thank you. Thank you. That was good. And you know, just to give our hats off to public health, when you think about historically, public health has done more to increase our health, our longevity, than any other piece of healthcare or medicine, with sanitation and going out into the community long, long ago. That's what Florence Nightingale did. So if you can't tell, I'm a nurse. My name is Nancy Johnson. I'm the Chief Operating Officer here at El Rio. I've also lived in Tucson for almost 30 years and am still faculty at the University of Arizona College of Medicine and College of Nursing as adjunct faculty. And for 3 years, we have been working here at El Rio, which has been here since 1970, providing a safety net for our community. So our mission is initially based in taking care of the underserved and the uninsured in our community, just as you find with TMC and UMC and University Healthcare South, all the hospitals. We share that common mission of making sure that when people need care, they have a place to go, regardless of their situation in life at that point in time. But since I've been here 3 years ago, we've been really working on all the magical pieces that are part of El Rio to create an integrated healthcare delivery system that is about health. Because, you know, we spend our time, if you think about when you go seek healthcare, you go in an exam room, and a physician examines you and comes up with a treatment plan and writes you some prescriptions and says, you need to lose a little weight, or you, not you personally, but you need to lose some weight. No, you need to quit smoking, whatever it is. But, you know, that's the time they have to spend with you. 90% of what makes each of you healthy and the people in your families healthy happens outside of that exam room. 90% of that. Very powerful. So, you know, with 17 locations across our community, El Rio needs to be able to optimize the health of our community. That's what we're focused on. Your health is our passion. You've got, you know, your little propaganda to take with you today, too. But so what we've created, and you're sitting in one, is one of our health homes for people, where when you come into this environment, not only can you see a physician, a primary care physician, you can also collaborate with a behavioral health consultant, a registered dietitian. We have community health advisors that kind of navigate, make referrals, hook you up, that sort of thing for other pieces. You can get your lab drawn, you can get an x-ray done here, you can fill your prescription here. So under one roof, within the electronic health record, we can see all the parts of you. And if you go to one of our other sites, we can see what you have done here. So, you know, that's that transparency that allows people to take the best care of you they can and to give you the resources to stay as healthy as you can. So really, when we're thinking about prevention, we're all about preventing nutrition, managing your weight, exercising. This facility is particularly great because right adjacent to us is a full-service gym, right? So all those kind of great things on this property here. But, you know, those are the primary prevention things. And then secondary wise, making sure you get a colonoscopy, a mammogram, you get your blood drawn, all those things to let us do early detection that things are running amok, right? And getting you straightened out. So that's kind of the model we're working on in building this interdisciplinary team of people to keep people healthy. Because the reality is that will save us dollars as business owners in terms of healthcare costs. We have some RN care coordinators in many of our sites. In the last year, in working with United Healthcare for our high-risk patients, they have brought ER use and hospital use down 20%. It's pretty amazing in 12 months. And these are high-risk people that got all kind of disease and medications. So, you know, it demonstrates the management of high-risk people can make a difference. So we got really, really excited when I met my friend Andrew here, and he said, you know, the Canyon Ranch Institute is really interested in bringing the Life Enhancer program, which Mel Zuckerman brought about in 1989 to offer to the guests that stay at Canyon Ranch, to your patients, to your employees, to your community. So we started that adventure last April. We have run our first cohort of employees through to give them some additional skills, hopefully insight into their own health behaviors and the ability to work better with patients on that platform. And then just this week, we started our second cohort of Spanish-speaking only patients in this cohort, so everybody's working on that Spanish, of our patients here. And we'll be taking them through that process of discovery to and I think, you know, in passing the baton here to Andrew to talk further, is for our patients and our employees to think about health, to have the dream of health. Because people don't think about it, right? You go through your day, you take care of your kids, you buy food, you do whatever. But to dream of that possibility of really being healthy and feeling that energy. So this is our exciting partnership, tied in our belief system about public health as nurses, physicians, whatever our discipline might be, and then being able to hook it up with this really amazing evidence-based program, working on our evidence-based, so we can get insurers to pay for it.
I have a surprise.
You have a surprise? Okay.
I have evidence.
You've got evidence, great, okay, go.
Yeah, so I'm the newest to Tucson,
Yeah.
by many years, but not the newest in public health, I have to admit. My name's Andrew Pleasant, I work at Canyon Ranch Institute. We do everything through partnerships, so the theme of this panel is perfect for us. We literally don't do anything on our own. We have two sort of groups of partnerships. One focuses on informing health policy. So we're founding members of something called the Stop Obesity Alliance and the Partnership to Prevent Chronic Disease, both of which were very active in the national health care discussion. Shall we call it? Discussion. The ongoing discussion. The other part is programs on the ground, and sort of the flagship is this Life Enhancement Program. We were founded by Melanie Zuckerman and Jerry Cohen, and Amy's just going to call me on something that I say wrong here, I know, and that's okay. But about 10 years ago, I've been here for about 3.5. I was at Rutgers in the World Health Organization and other universities before that. So the first group of the Life Enhancement Program, which really is based on the vision that Mel had at Canyon Ranch, which everybody's heard of, but nobody's heard of the Institute. We're a nonprofit, 501c3, dedicated to bringing the ideas of Canyon Ranch to people who can never afford to go there. So we work in low-income communities around the United States and now the world. This program with your employees, we just started to look at the data. We improved physical and mental healthy days per month by 50%. And now, think about that, right? That's 50% improvement. I kept, we looked at the data yesterday. So, and stress decreased, depression decreased, cholesterol decreased, number of push-ups increased. And
The number of push-ups increased, I'm good.
So, you know, it's proven to be a really strong program. It started in the South Bronx. Fort Apache, if you heard of that, was one of the most violent communities in the United States. It's also the birthplace of the president of Canyon Ranch Institute, Dr. Carmona, who we started in the South Bronx because when he was a child and homeless, he remembers that physician that we work with providing care for free. So they actually came and experienced Canyon Ranch, then the idea for the Life Enhancement Program in low-income communities came out of that visit of medical professionals. There we've done, the numbers are astonishing. People get better at this every time, the group that gets it. So in the South Bronx, they're reducing depression in all participants by 56% across the board.
Wow.
And these are people who have really been homebound. We also have the program in a very small town in Missouri called Milan, a teeny little farming community, very low income, and in inner city Cleveland with the Cleveland Clinic. It's always a partnership. Federally Qualified Health Center or a hospital, as the case may be. That program is growing and will be in many cities over the next few years. Another program that we just finished actually is our first international one for the Institute. That was in Peru. And they're in what they call a Pueblo Jóvenes, or basically it's a shanty town, where people just fled into Lima, Peru after the revolution and, you know, built whatever they could. So it's an incredibly low-income community. We use the arts there, theater, in a partnership with the Clorox company, which is another thing that we do that a lot of public health agencies don't do. We work in the corporate social responsibility space a lot and very effectively. So Clorox funded that program, but it wasn't branded. Nobody in the community knew that it was funded by Clorox, nor did we ever try to promote or directly sell Clorox products. They were interested in figuring out how to make people healthier, and they decided to work with us to do that. So we put on a 12-episode play in the community that was open-ended. So the community members told us how the play ended each week. And we addressed household hygiene practices, how to live healthier in basically a shack. Right? And of course, what happens is when you have this discussion with people in that community, one of the bigger problems is that the water that's delivered is already unhealthy. So then how do you clean that? Well, lo and behold, They, on their own, I kid you not, said, we need to figure out how to use bleach,
Wow.
right? Because that's